All right, we are back with another clinical conversation, and today we have Emily Elliott, and we are talking probably the hardest thing a physical therapist has to deal with in their day-to-day life, which is notes, their documentation. And we're going to start by talking a little bit about like where notes are for most practices, I think, right now, and where they've been for the last few years. And then we're going to talk about the future of notes, which is AI technology. AI is obviously taking over and getting itself into every aspect of work and life these days. And this, I hope, is going to be a welcome technology into the physical therapy space because, again, documentation, I think, is the bane of a PT's existence. But yeah, Emily, tell me if I'm right there, and also tell me a little bit about where notes were and kind of that journey to where they're becoming and going.
Yeah, spot on. I don't think I've ever heard anybody say, I love writing notes. I became a therapist so that I could write a novel every day. I've been a therapist for over a decade, and it's really kind of cool to see that evolution of documentation. So when I had my first job, everything was still on paper. Probably one of the last generation that had to handwrite their notes and manually calculate their charges on a charge sheet to give to the person to be scanned. And then fast forward now where you see digital EMRs, and there's a lot of them out there, and they have some really smart workflows to help support the clinician. But the demands that we see in healthcare with the level of details that insurances are requiring to put in the notes, it's a lot to maintain. And I know that I'm not the only person who's experienced burnout, right? You want to take good care of the patient that's sitting in front of you. You went to school to foster a relationship, and you want to use your brain to problem solve. They come in with this problem and you want to spend time with them and not be in front of the computer. But in reality, what that looks like is at the end of the day, you have notes that aren't done. And so you're either staying late in the clinic, you're taking them home with you, you're maybe coming in the next day, or worst case scenario, you fall a couple days behind and then you're wondering, what did I do with them last Tuesday? Was it 30 reps or was it 20 reps? And it's a really frustrating experience because those notes are always there. They're not going away. So what's really kind of exciting to see this year in this evolution of physical therapy is not just to support documentation, right? Where you click on a text box and you just say what you want to be there, but this AI, it's wildly intelligent where you walk into your visit, you hit record, and then you just have this patient encounter. You do your entire visit, then you come back to your laptop and you say, stop recording and write my note. And it writes the note for you, right? The time that we see it saving, the quality of the notes that are being written is really something we only dreamed about a couple years ago. And the impacts are really kind of fun to start to see.
But okay, you're treating your patient and AI is listening.
Yes.
But isn't the clinic listening also? Is that like, are you now like speaking differently, speaking more loudly, and then the PT and the patient next to you are like, okay, Emily, like you're a little loud
It's a
talking
battle.
to your talking to your AI. Like
Who can scream the
that-
loudest? Yeah, I mean, some of our clinics that are busy, they have like little lapel microphones, right?
Okay.
So that it goes, and they're mobile. So they don't want to just be next to their laptop where the microphone is. They like to run and walk around the gym and be mobile and not be confined to the microphone. And so that is a reality in an open gym setting that works really successfully. But technology has evolved, and I had that same concern. I was like, this is never going to work, but it does. It can listen to the patient caregiver. It's intelligent, and it is able to tweeze out what's medically relevant to the conversation and tweeze out the things that aren't. So if you're having a conversation with somebody talking about a baseball game, it's not going to put that in the note. It's wildly intelligent, and it's really cool to see.
Wild is a good adjective. All right, and then what about? Okay, so let me throw you another one. I'm treating Emily, and I'm like, all right, cool. You got your hip abductions going, 3 sets of 10. I'm just gonna go check on Ashley. I'll be right back. And I'm going to have my aide monitor you. I'm going to go work with Ashley, my other patient. And so now it seems like it can't be that wildly intelligent where it just knows you're transitioning to another patient.
Yeah.
Yeah.
Well, yeah, stay tuned. Stay tuned, right? So the workflow as AI exists currently is you start and you stop the recordings as many times as you need, and you transition between patients. And at Cora, we leverage with Comprehend, and it's set up for that busy, fast-paced environment. So what a lot of our clinicians will do is something called a quick record. So it's a feature within Comprehend where you can toggle very quickly between your multiple patients and record those experiences, or even do something called just a brain dump, where like, I'm not even going to bother recording. Let me just go do and be what I love. And at the end of the hour, the end of the day, I'm going to come and just do a brain dump. So I'm going to say all the things that Ashley did and how he responded and how the goals are progressing and what pain rating it was. and then I'll do another brain dump for the next patient, and then I'll go back and have it write the note, review it, and call it a day. So there's multiple approaches to use AI, but the technology at the end of the day is the same. It takes and listens to that information. It's intelligent to know what belongs in the note and where to put it. So all you're doing at that point is just reading the note. The other really cool thing about Comprehend that I think resonates with a lot of people is it's unique to learning your style of notes, which is important, right? We don't want cookie cutter notes because we want our patients to get a unique experience and the notes to reflect that. When we use AI, it learns your style of writing. It learns how you like things to be done, your treatment style, and reflects that into the note. And that's the part that I think is just really fascinating and where the time saving part comes in, because you're not editing some generic note. It's learning how you like your notes written so that you can sign off on them faster. It's cool. It's really cool.
The PTs who are like probably retiring are probably like, where the hell was this 20 years ago? It is. I mean, this is so cool.
And that's true. We have people at Cora. I'm looking at some of the data, right? Who are the people that really latch onto this and really love it? Because I had some preconceived notions of like who would be early adopters and who wouldn't. And I was looking just this morning at like the top 10 people who are super users, and it's all over the board. It's PTs, it's OTs, it's our more seasoned clinicians, it's some new grads, it's people that are managers, people that are staff clinicians. And so I think this is just resonating with people. It's hitting a need, a real pain point in the industry of being stuck and confined to behind the computer and not being able to do the things that you love. It's very successfully doing that. I think the numbers and data are starting to kind of show what we knew all along, is that we needed a solution to help with a part of PT that we don't really like.
What is the learning curve like? So is it difficult to get, I bet it's more difficult just to be comfortable with it than it is to use the technology. I've used some AI and it's not very difficult. It's just getting comfortable with it and expanding, then beginning to expand the criteria.
Yeah, I thought it would be a really steep learning curve, just to be honest, right? Because I was still that clinician that didn't mind having the exercises printed out. I still have sticky notes in which I have to do stuff. It's really intuitive. At Cora, we already have it installed on your computer, so you don't even have to worry about, hey, how do I sign in? How do I get it? But it's a matter of clicking like start the visit, stop the visit, and then hitting the button of like write my note for me. So we use Comprehend, so the button is Comprehend, and then you review it, and that's the learning curve. You can tweak the note as you need, and then there's another button called Learn. It's a little picture of a brain, and it learns the changes that you made. So maybe they say like an average of like 10 notes to get them really streamlined, so you're not doing any editing anymore. So you're looking at like a day or two of like refining and teaching the AI to write notes how you want them to be written. I think that's pretty fast. I mean, people are seeing benefits just from the first note, but really that first week, you're never going to want to go back.
Emily, tell me your thoughts on this. And side note, I will say it's been amazing to me the amount of like the clinics I'll go into or clinicians I speak with that they're excited to share. Hey, come look at this. I want to show you. You know, like I love to watch it, but it doesn't seem from their experience like there isn't a complaint. There's excitement around it, and people don't like change. So that speaks to itself right there, Emily, on what you brought. But you know, something I think about is particularly for those that are new and outpatient, your newer grads, just having that structure of like, for an example, like an evaluation, how do you get through that quickly and effectively? As an experienced clinician that kind of knows exactly what I'm getting after, I'm hunting for material, I could see where this just opens doors to like, no more of this.
Yeah.
You know, but if you're newer to it, I would imagine it only benefits the clinician early on to really kind of focus on what is it you're after, so that way, as the computer's analyzing and helping with that and learning through it. Any thoughts on that?
Yeah, it is. I think some of the feedback that we're getting, especially from new grads who maybe it takes them a little bit longer to go through that clinical reasoning process and reflect that into paper, that the AI is doing a really good job of capturing that. The AI technology that we use also has something called a chat feature. So you hear like Copilot or ChatGPT where you go in there and you put a prompt and you're having a conversation with a robot. Comprehend has that too. So it has the note writing feature, but there's also this separate chat bar. And I think a lot of the newer clinicians find value in that because you can go and say, hey, I forgot the CPG guidelines for low back pain and the treatments that go along with that. And it's looking at the patient you have open and it can give you those recommendations. Or, hey, I'm not really good at ICD-10 codes. What are some ICD-10 codes you would recommend? It's kind of like this assistant, right? That can give you a jump start to help support your care, right? You got to know the questions to ask, but you're not going to Google to ask it questions. You can ask it very specific questions related to the patient note that you have open. You can say, hey, write me a letter of medical necessity, or help me write a letter for an orthosis or a wheelchair. And if you have done that evaluation, it's going to use that data and really expedite that process of supporting that patient without you having to stay late, right? Helping you do your job well without having to bleed into the other parts of your life and your time.
Adam, the real skill is figuring out how to ask these questions without the patient thinking you don't know what you're doing.
well, that's why I said, like, expanding the criteria, trusting the process, like learning, like that what you probably think it's very elementary what you have to ask it, like old school queries in Google, but it's like, no, the AI is like, challenge me, give me your best question, trust me, you're gonna impress you. Well, let me ask, like, the next logical question I think would be like, where is this going? Does it have the capacity to like create a plan of care? And again, using AI, what you typically do is, right, you put something in, you put your prompt in, you get your result, and then you take out your sandpaper and you take out your paint and you start to really fine tune and make it the end product that you want. You don't just take the product and then put it out. Does it have the ability to create the plan of care?
I don't think it's ever going to replace decision-making process, right? Like that's the value, and that's the thing that we love about physical therapy is the actual problem solving and using your brain. I see the future of AI going to be maybe even a little more hands-off, right? There's technology now where you put on a pair of glasses and instead of calling out measurements, okay, raise your hand, shoulder flexion 120 degrees on the left, you have a camera on your glasses that's just looking at the patient's movement and turning that trait straight into a transcript, right? I think a blend of these technologies to make it a little more natural and seamless of an experience. Well, I already know Comprehen's future-minded and thinking about how can we keep therapy rooted in what matters and take away some of this administrative burden. There will always be the need for that human connection, for that clinical decision making. But I think you're right. It's going to only continue to be bolstered and supported through technologies like AI.
It's going to keep clinicians better in line with what the research is as it changes and ebbs and flows. And, you definitely put a picture in my head of a matrix with the clinicians with the glasses on in the clinic. Right. And it's kind of cool. Yeah,
it is. It's weird to think that some of the things we saw in movies or read in books is actually happening. And I'm excited about it. Right. Like I don't believe it till I see it type of person, but the buy-in to me comes with the time saved. Right. And clearly there's a lot of clinicians that see the value in that too.
Wild. All right. Well, I think that was a good introduction to AI technology, note-taking, and kind of really where we're going with this, which is, like you said, it's wild. It's exciting. It seems to be like a real game changer for your physical therapist. If this is taking all of that time and sightline, like Ashley said, you're looking at your computer, you're looking at your patient, you're looking at your computer, you're looking at your patient. Like this removes the need for that and just lets you focus on your patient. That's crazy. Anything else you want to share on the topic or anything I might have missed?
I'll just say that the other piece that I see this moving towards is not just away from the laptop, but transitioning to like a phone. A lot of AI apps are now out there. Comprehend has one, and it just allows more freedom and more movement around the gym space, and for a more like seamless experience, especially for some of our clinicians that aren't treating in traditional spaces, right? Maybe they're going into homes where there's not great connections, but there is cell service, right? They can still record a home health visit. Or for those pediatric patients where you're never in front of a computer anyways, because your hands are always going to be on your little kiddo. It's really cool to see technology evolve to support the therapists that we have in that space.
I think it's also a necessity too. It was just a few years ago that we were 12,000 physical therapists short in the U.S. And I think the thought is that up until 2030, we'll continue to see a gap in the amount of health care clinicians that we have, and this technology allows patients to get in quicker and hopefully respond quicker, meet their goals, and get on with their life.
All right. Well, great conversation. I think we're going to continue it in our next episode. So thank you for tuning into this one, and we'll talk to you soon. Thanks, guys.
See ya.